Hi, my name is Kazia Mamet, and today I'll be talking about what an anatomical position is and the different characteristics that is a part of the anatomical position as well. First off, I would like to explain and define what an anatomical position is. An anatomical position is one of our most standard positions in healthcare. The purpose of using an anatomical position is so that we could clearly see the different parts and different organs of your body, whether it's moving or whatever position that they are in. Now, doctors and healthcare professionals like to use this so there's less confusion, because if doctors and healthcare professionals look at the same body in different positions, there could be more confusion that is brought forward, and that could lead to mistakes. Because, for example, let's say one doctor looked at the body in an anatomical position and another doctor looked at the same body but in another position. For example, the supine position, which is your back is laid flat. Now, although they're looking at the same body with the same organs, they could easily confuse each other because one doctor is looking at the body in a different angle, and it's the same with the other doctor. They're looking at the same body in a whole different angle. So if they're talking about the same organ, there could be confusion when talking about this patient. Now, I would also like to show you what an anatomical position looks like and the characteristics. So I printed out a picture of what an anatomical position should look like. If you see here, the head is facing forward, the upper limbs are laid on the side, the palms are facing forward, the legs are parallel to each other, and the feet are on the floor. If you see here, there's a little bit of space by the legs as well. And this is what an anatomical position should look like. As well as anatomical positions is better for healthcare. Doctors and healthcare professionals also use directional terms to talk about the part of the body when referring to the anatomical position. For example, there's anterior, which is the front of the body, posterior being the back, medial being closer to the middle, and then lateral being away from the middle. Superficial is towards the head, and then inferior being away from the head. Proximal meaning closer to the organ. For example, if you see my arm, proximal will be closer to the bone, while distal is like the farthest from the bone. And these terms are used when talking about different parts of your body between healthcare professionals. And we also have body plans as well. Body plans are they're used as well to describe parts to look at your body parts a bit closer. For example, there is sagittal, which is a vertical line that divides the body into left and right sections. There's also coronal, which is also another vertical line that divides the body into the front, which is the anterior, and the back, which is the posterior sections. And lastly, we also have transverse, which is a horizontal line. Instead of vertical, it's horizontal, and it's split into upper, which is superior, and lower, which is inferior. And that is all we have for today. Thank you.